let's jump down here. So we have the axial skeleton contacting these bones off to the side over here, which are going to be part of the appendicular skeleton. These bones are called the coxa bones, right? What makes up the coxa bones? Which three bones make that up?
Ilium,
Ilium, ischium, and the pubis, right? So which one am I touching here? The ilium. Which one am I touching here? Ischium. And which one am I touching here? Pubis. And the pubis bones are connected by this thing called the pubic symphysis, which is made out of
cartilage.
Yeah, fiber cartilage, right? What's that hole called?
acetabulum,
No, this hole.
Something kind
foramen,
It's a foramen. What's the name of it?
obturator.
Yes. What'd you say? Obturator foramen, right? The obturator foramen. When you're sitting, you're bearing your weight on this process here called the ischial
Crest.
tuberosities, right? The ischial tuberosities when you're sitting there. That obturator is going to help hold a bunch of these hip muscles there. All right, now these three bones are all going to fuse at one point, and the area that they fuse in is called what?
acetabulum,
The acetabulum. And what bone's going to fit into the acetabulum?
The head of the femur.
femur,
The head of the femur is going to go into the acetabulum, right? So then we have the head of the femur here. We have this big bulge. What's this big bulge called? Greater trochanter, right? And then we follow the femur down, and then we have a bone here in front of it. What's that called?
patella,
The patella. What kind of bone is that? Sesamoid. What's the definition of a sesamoid bone? Where they develop?
at the joints,
In the joints, behind tendons there, right? So we'll have a tendon up here, a tendon down here. What's the tendon down here called?
patellar tendon,
The patellar tendon. What's the one up here called? It's named after the group of muscles that are in the front of the leg.
Quadriceps.
Hmm?
Nothing.
No. Here. What?
Quadriceps.
Yeah, quadriceps tendon. All right. Okay, so then
quadricep
tendon. Right. And then we have the weight of the femur coming down onto this big bone. This big bone is called the
fibula,
tibia. The tibia has an articulation over here that's a slightly moving articulation. What's the name of a slightly moving articulation?
Amphioarthrosis.
Amphioarthrosis, right? And that articulation is with this bone called the
fibula,
the fibula. The fibula is that a weight-bearing bone? No. Right, it's going to have a lot of muscle attachment on it, though, right? That's going to be coming down onto the foot, and it's going to be they're going to be articulating with what bone on the foot? The talus, right? The talus is then going to be articulating to the back with
Calcaneus.
the calcaneus. The calcaneus is going to be articulating forward with the
Tarsals.
what's the name of this one?
Oh, it's got a special name. Coronoid.
It's shaped like a cube.
cuboidal,
Cuboid. All right, then let's get back to that talus. That talus is articulating in the front with the navicular. The navicular is articulating with these three bones called the cuneiform, right? Cuneiform bones, and they're going to be articulating as well as a cuboid with the metatarsals, right? The metatarsals are connected with the phalanges, and how many phalanges do we have in each toe?
3,
Three. How many do we have in the big toe?
2,
What's the big toe's name?
hallux,
Hallux. Are you sure?
yes,
So let's take a look at some bones, because you will want to be able to identify the bones, because when you come in, there are going to be bones set up around the lab. The questions will be something like identify the bone and list all the articulations. Don't bother asking me how many articulations are there for this bone. I'm not going to tell you. I'm just going to say list all the articulations. So you want to know all the articulations. If you have to, cheat and look at the skeleton. The skeleton's going to be in the room. All right, so figure that out if you have to. But then you'll list all the articulations, which mean proximal and distal articulations. In some cases, I might even ask you to specify distal or proximal articulation, or list them that way. So get used to saying that term. So what bone is this?
femur,
The femur, right. If you have a broken hip, are you breaking this or your coxal bone? You're breaking the femur, right? You have a break here. You can take this out. Is there a lot of muscle attachment on the neck here? No. So you can just cut this off right here, put a metal spike in there, hammer it in. You got a little titanium thing, slips right into the acetabulum, right? Okay, so then what are these things called? We got three different answers. Medial lateral epicondyle? Okay. I'll take that. What's this called?
Scapula.
Scapula. What's this thing called?
The
Acromion, right? And what's this thing called then? What is it? Cor what? Cornoid? Or coracoid? Which one is it?
Coronoid.
Cornoid? Okay. Coracoid? Okay, we'll take coracoid.
Crocoid.
Alright. Okay, so then, what's this?
Patella. Sesamoid.
What's this?
Clavicle.
Clavicle. It has two prominent markings, one near the
Manubrium.
the medial or lateral end of it. Which one is, what are these two prominent markings? Which one is located proximal to the manubrium? What's the name of that bone marking?
The sternal end.
Yeah. No, what's the name of the bone marking? Alright, let's make sure we look them up and share them with people when you find them. Alright, what's this bone called? Talus. Talus is articulating in the front with the navicular. Navicular is articulating with the cuboid. Articulating with the
Metatarsals.
metatarsals and the
Phalanges.
phalanges, right. The talus articulating in back with the
Calcaneus.
calcaneus forward with the cuboid and forward with the
Metatarsals.
metatarsal. If you, assuming you have a normal arch, when you are standing, the weight of your body is being distributed to the ground through which bones?
Calcaneus and the
The
tarsals.
calcaneus, the
And the phalanges.
metatarsals, and the
Phalanges.
phalanges, right. What's this?
Sacrum.
Sacrum and the coccyx, right. What are these? Carpals, these.
Metacarpals. Phalanges.
What bone is this?
Humerus.
Humerus, how could you tell?
This is scapula head and scapula.
It's got these the trochlea and the fossas on these two ends, right? So which fossa is which? Can you tell? Make sure you touch it. Make sure you can. All right, before you leave. All right, then. What bone is this? Coxal bone. Which? What are the three components of it again? The
Ilium, ischium, and the pubis.
and the three of them come together and form the
Acetabulum.
acetabulum, right? What nerve is going to be flowing through here? Remember, it gets a little numb when you're sitting. Yeah, sciatic. Which one is this?
The break.
The radius.
Is it the radius?
That's the
The fibula, right? It's the fibula. What's it articulating with? On the what's it articulating with distally?
The
Distally with the talus, right? And
Yeah.
proximally, and also with the tibia.
Oh,
with,
yeah, the tibia.
And then over here with the
The tibia and
Patella.
the patella.
yeah,
patella bone.
right. With that tendon for the patella is really coming up here into the tibia, but we can see it's a clear articulation with the tibia, right? Okay. Which one is this?
The ulna.
The ulna. How could you tell?
Because of the opening.
Yeah, because it's got that claw, right?
C.
That hinge. And again, this process back here is the
Capitulum.
the olecranon, right? The olecranon's that elbow. If you touch your olecranon and then you touch the medial condyle, you'll feel that little groove in there. What nerve's running through that little groove?
The funny bone.
Funny bone one, which is called the,
Can't remember.
starts with a U, ulnar nerve, right? Ulnar nerve. Right, okay, then what's this little process called on the end of it? Styloid process, right? Okay. Which one's this?
Radius.
The radius, how could you tell? It's got that radial head. That radial head is going to be articulating with what point?
The capitulum.
The capitulum of which bone?
The humerus.
Of the humerus, right? What's this bump on the radius called? The radial tuberosity. What's going to be inserting there? The bicep tendon, the tendon of the bicep, right? some of our vertebrae. What's this thing called? Is that a patella?
Intervertebral disc.
Intervertebral disc. The intervertebral disc. What's that membrane called again?
I know how I is.
The annulus, right? And the inside, that elastic core is going to be the nucleus bulbosus. Which one's this?
Patella.
Patella, right? Great. And this one? The what? The tibia. And what is this called? Medial malleolus, right? And on the fibula, it would be called the lateral malleolus, right? Dude, then what else do we have on this list? Oh yeah, we've got the. Make sure you take a look at those slides. The two types of ossification. Make sure you can identify them, tell them apart, and make sure you can list the steps involved in the ossification. What's the fast way to tell if you're looking at endochondral ossification? What's it look like? Round. But what makes up endochondral ossification? What's our starting material?
Mesenchymal.
Osteoplast.
No, it's not mesenchymal. Mesenchymal is the
Osteo-
intramembranous. So this endochondral is
osteoprogenitor?
going to be the. What kind of cartilage? No. Hyaline cartilage. It's going to be the hyaline cartilage. So what does hyaline cartilage look like when you look in the microscope? It's going to look like a big slab, right? A nice, shiny slab of cartilage there. And when you see that shiny slab of cartilage, then you know immediately you're looking at endochondral ossification. If you're not sure and you zoom in, what else might you see? Where does endochondral ossification occur? What kind of bones? And long bones. And in long bones, you're going to have one inside of them.
Spongy bones.
You have the red marrow, right? The red bone marrow. So you'll see a bunch of those little red dots all in that slide. So you see those red dots. You see that big broad sheet of shiny cartilage. Then you know instantly that you're looking at the endochondral ossification. The intramembranous ossification starts with what?
Mesenchymal cells.
Mesenchymal cells. So if you're looking at that, you're going to see these lots of spindle-shaped cells up close. But even at 4x, you can appreciate instantly that the endochondral ossification, intramembranous ossification, has kind of like an interwoven appearance. You see these spicules forming, and it looks like something's being woven rather than the big shiny sheets of cartilage. All right, what else is going to be on this test? Yeah, I think that'll be on this test. But we're gonna meet next week and take our second test, and then when we come back from spring break, we're taking what? As soon as we walk back into this lab, we are doing the midterm, right? And when we're doing the midterm, what's going to be on the midterm? Everything up to this point, right? So this is pretty much your last chance to look at those other slides if you want to take a look at those slides again and just make sure you know what you're looking at. If you want to, just let us know. We'll break out a microscope. We can put them on there real fast and just let you take a look at all of them. Make sure you see what you're supposed to be seeing. Also the blood models, the skin wedge model, the what else? Cell mitosis. These blood guys, yeah, these muscles, right? Take a look at the posters again. The parts of the microscope. What's that piece called when I want to change the objective? I don't grab the objective. I grab this. I grab the nose piece, right? Grab the nose piece to move it. And then what are the two types of focus that we have on the microscope?
Fine focus and
Fine
coarse focus.
And then what are those? Eyepieces?
Objective.
Yeah, the ocular piece, right? What type of magnification does that have? 10x, right?